speaker is Jennifer Lee. She is professor at Department of Ophthalmology, UC Davis. She is director of the Corneal and External Disease Service at UC Davis. And her topic today is lessons learned from COVID-19 and the long-term impact on eye banking. Jennifer.
Great, thanks so much. Hopefully you guys can hear me and see my slides. But thank you, Dr. Aldave and Dr. Sharma, for the invitation just to participate in this symposium today. I thought, in light of the past 2 years that we have, that we talk just a little bit more about COVID-19, but hopefully get to some of the longer term impacts that COVID-19 will have for us as corneal surgeons. I have no financial interest to disclose. So over the next 10 minutes or so, I thought we'd look at some of the lessons that we've learned during the pandemic, how the pandemic has progressed, the ocular manifestations of disease, how it impacts corneal tissue. But then I really want us to focus on the lasting impact of the pandemic on eye banking, corneal transplantation, and hopefully touch on just a little bit the global burden of corneal blindness. The course of the COVID-19 pandemic is obviously something that we're very familiar with at this point. At last count in the US, we've had 78 million reported cases and nearly 1 million deaths. Around the world, 419 million reported cases, again, probably a significant underestimation, and nearly 6 million deaths. And despite decreasing numbers here in the US, around the world, there are still certain hotspots with Omicron in many places. And we really may never know the true impact of COVID-19 around the world for lack of widespread testing in certain areas of the world. And I know we are all very tired of talking and thinking about COVID, so I'll try and make this interesting. But before I get to what I think is the more interesting part, we're just gonna do a quick review. By now, we should all be aware that one of the primary impacts of COVID-19 on the eyes can usually cause a conjunctivitis. In some reports, there's as many as 30% of patients may develop some ocular manifestation of COVID-19. And with COVID, as with many viral conjunctivitises, patients most commonly have a bilateral follicular conjunctivitis. Conjunctivitis can be either an early presenting sign of COVID-19 or may develop later with more severe disease. There have also been scattered case reports of more severe ocular surface involvement, including a case of unilateral keratoconjunctivitis and a case of hemorrhagic pseudomembranous conjunctivitis. Posterior involvement has also been reported, although it appears less common. The most common posterior involvement involves microvascular disease with retinal hemorrhages, cotton wool spots, dilated vessels, and there are some reports of CRVOs, panuveitis, and even optic neuritis. So in light of what we know about how COVID-19 affects the eyes, what implication does this ultimately have on donor corneal tissue? Again, at this point, we know that SARS-CoV spreads from exposure of infected respiratory droplets and aerosol particles to exposed surfaces, including the ocular surface. Multiple studies have demonstrated the expression of ACE2 on the conjunctiva and cornea of the ocular surface. And ultimately, SARS-CoV-2 depends on entry of the viral spike protein binding to the host ACE2 receptors. And so ACE2 is found on the ocular surface. But when looking to see if SARS-CoV-2 can actually replicate on the human corneal tissue, we've actually been unable to detect true replication of SARS-CoV-2 on donor corneal tissue. And so this suggests that perhaps human cornea and conjunctiva may not really support infection of SARS-CoV-2, despite the presence of these receptors. But obviously, for those of us who are performing corneal transplantation, we still need to know if donor-to-recipient transmission is possible. And unfortunately, SARS-CoV-2 mRNA has been detected on conjunctival swabs and even post-mortem vitreous samples in the eye. But to date, as far as I'm aware, there's still only one reported case where infectious virus was cultured from the ocular swab. When we tested donor corneas for transplantation, studies have shown that there can be a relatively high rate of positivity even in asymptomatic donors. In one study where they started doing routine post-mortem testing on all donors, they found nearly a 5% positivity rate on donors who otherwise would have met all other criteria for transplantation. Okay, so in light of how far we've come and how little we knew 2 years ago about COVID-19, I have to say I'm actually very, very impressed and proud to be part of the response that eye banks across the world have had in response to this pandemic. We have put safety first, and that's not just safety of the donor tissue and our recipients, but it's safety for our recovery techs and our processing eye bank technicians. It's safety for us as surgeons, and safety ultimately for our communities. We have really stepped on trying to make recommendations from a very early time in the US. We've been on the ball starting in January. We've come up with guidances regularly based on new information, based on CDC recommendations, based on advice from infectious disease experts, and based on feedback from surgeons and eye bankers. I do not want to spend a whole lot of time on our current recommendations, but these can be found on the EBA website. The most recent recommendations have decreased the duration of time, shortened the duration of time of donor ineligibility after a positive COVID test. Finally, what I want us to focus a little bit on today is the impact of COVID-19 on eye banking and corneal transplantation globally. In the US, at least in 2020, you can see how the shutdown caused cessation of elective cases, and there was a nearly 80% decline in corneal transplantation, corneal tissues being recovered. By the end of 2020, we were actually able to recover up to about 85% of normal volume. The 2021 numbers are not yet available. Around the globe, we saw similar impacts. In India, there was, again, close to 80% reduction in corneas recovered for transplantation during the peak of the shutdown. In Italy, about 58 to 60% reduction. Germany seemed to do a little bit better than the rest of us with only a 17% reduction. But obviously the impact is not just on the donor tissue, it's on corneal transplantation ultimately. And with corneal transplantation grinding to a halt during the lockdown, you can see here, the numbers is dropping precipitously in March and April of 2020. In the US, surgeons have had the luxury of resuming near normal surgical volume. But the same really can't be said for our colleagues who depend on tissue from US eye banks around the world. We see the impact on corneal transplantation in other countries as well. In Mexico, there was an 88% reduction in public institutions and a 64% reduction in corneal transplantation at private institutions. And you can see how setting can impact, again, healthcare disparity. In Brazil, they saw an 82% reduction in corneal transplantation during the elective surgery moratorium. But even after resuming elective cases, there continued to be a 30% decline in cases. Which brings us to sort of the final point, which is that the long-term impact on patients globally waiting for corneal transplantation is going to be quite profound. In Brazil, they estimate that in order to reach pre-pandemic waiting list volumes, they would need an 81% increase in monthly transplantation over the course of 2 years. And so with the problem that we've had with corneal transplantation worldwide, even prior to the pandemic, we're going to have bigger problems long-term going forward. And so my final thoughts are really just that eye banking and transplantation, we're not immune to the problems that the rest of the world is having with things like global supply chain issues. We've had delays in supplies, we've had delays in shipping, and these impacts, again, are not going to recover overnight. We continue to not really know the final impact of COVID on donor corneal transplantation. I suspect that the risk to our recipients is actually going to be quite low. And so hopefully over time, we'll be able to open up the donor pool further and further to help the problems that we have with access to tissue. And then finally, we'll continue to balance the safety of the donor pool with the needs of recipients and surgeons. But again, the long-term impacts are going to be coming for many, many years. And as a group, I think we need to start really focusing on healthcare disparities around the globe for all of our patients. Thanks so much. Sorry for the dog.
Thank you for that wonderful presentation. And is this the culprit on the slide?
Yes, it is. And it's getting past her
Okay, now,
bedtime.
Scout, is that correct?